Hi everyone, it's Nick here from Notero. Today I'm going to go through the anatomy of a soap note. So let's begin by taking a look at Hank Jones' soap note. The first section, the treatment type, the date, the time, the length, and practitioner have all been pre-populated from an appointment. I created the soap note from the appointment. If I didn't, I would have to fill all these areas in. The next area is a summary. This is his health summary, either from previous soap notes or intake forms. If you needed to update his health summary, you can click on the plus button and do a search. And he was complaining of left gluteal pain. I can put some comments and click save. I can also do a search by clicking on conditions and just scroll through the check boxes, as well as in these other sections, the health questions or the COVID sections. And that will update his health summary. The next area we're going to look at is the SOAP, the assessment and the infection prevention. We're going to start with the text fields. If you're someone who likes to type a lot of information, I would suggest use a mobile device. All mobile devices have a microphone icon that allows for dictation, and I'll demonstrate how easy it is. Mr. Smith was complaining of low back pain, period. And as you can see, you can dictate or talk a lot quicker than you can type. The next area we're going to come to is the tag. And so we have a tag feature and a draw feature. So let's take a look at the tag, but before we do that, I'll show you that there's a number of images that you can select from just by hovering over the thumbnails. So we're going to leave the diagram that we have up here, and I'm going to start tagging. So I'm going to put just one tag on initially, and we're going to click on the top of the head here. And you can see it's selected left frontalis, and it's made a number of other selections here. And it's done that because these are the selections I usually pick for this area, as well as the tags I usually use for this area. So I'm not going to say it's left frontalis, I'm just going to say it's the forehead. And the person is complaining of headache pain, and it says 4 times a day, because this is a previous comment that I have added. And so what it's going to do, it's going to use or going to suggest comments that you've already put in here. So it's going to learn the type of comments or the wording that you use for the specific tags in this specific area. So it was 4 times per day, and I'm going to save and close. So that's simply putting one tag on the body. You can do multiple tags so you're not clicking all the time. So I'm going to hold down the shift key, and I'm going to click on this area and this area. And so this time it comes up right frontalis, and I'm going to leave it at right frontalis. And the person was complaining of pain, and we're going to say it was radiating. Let's correct that. And I'm going to save and keep tagging. In other words, I'm going to stay on this area right here. And I also did some trigger point therapy, so I'll search for that. And I didn't do a nice and stretch in this area, and so I'm going to just save and keep tagging. And also, they also had muscle spasm in this area. And then I'm going to go to the next position. And so now I'm down in this position right here, and it was the right trapezius, and yes, I'm going to leave that location. And it was pain on palpation, and it radiated behind the left ear. Again, a previous comment that I had put in here, and it's related to this. So I'm going to select that, and I'm going to save and keep tagging. And it was also tight, they complained of, and then I'm going to close. And so you can see all the subjective complaints get put into the subjective area. All the palpation or the objective findings go into the objective section, and my plan goes into the technique under the plan section. So that's how you would create soap notes using the predictive tagging. And as I was demonstrating, it's using the terminology or the comments that you're using, plus the tags that you're going to be using in each individual area, the suggestions that it's going to make for you. We also have a draw feature, and so you can mark up the diagrams if you want, and you can select also different colors of pens, as well as the size. if I want to make it much bigger. And you can erase what you've had as well. So the draw is just quickly click on the draw feature as well. So that's how you would create a SOAP note. And the next is the assessment section. And there's a previous assessment. So if I wanted to update a previous assessment, I would preview it. And if I want to update some of these range of motions, or if I did a rule out, I can just hit duplicate and it's going to bring all this data forward. But I'm not going to do that. I'm actually going to do a new assessment. And it's all based on the region. So we got the neck, thoracic spine, and all the way down to the temporal mandibular joint. We also have a neural section and a posture section. So if we look at the neck, we can do the rule out of the joints above and below, or we can just simply do a range of motion testing. And when you click on the range of motion testing, it'll put the normative values in here, and you can slide this little slider, and you can put any range that you've either estimated or actually measured, and you can put a comment in here. And it'll be auto-saving as you go along. If you didn't do passive range of motion, you can leave it. You can select one at a time, or you can turn them all on or off, as well as resisted range of motion. It's a different scale, and you can click on the different values or off. And then we have a special test section, and then palpation. And if we go back to the SOAP note, the range of motion testing that we did, here's the flexion. I measured at 31 degrees in pain, and these are all normal values, so I left that at normal values, and it's all then recorded on your SOAP note. And the last area that I want to show you is infection prevention. And this is just basically equipment that either you've worn or the patient, or both at the same time. So if a mask is worn, you just select mask or gloves, and so on and so forth. And they're just check boxes and whatever you've done to disinfect the area. And then you can go back to the SOAP note section. And so if you've done a complete SOAP note where you've gathered all the information, you've done an assessment as well as infection prevention, and you come to your action button, and you can just finalize your note. It's that simple.